Good afternoon, dear colleagues. Welcome to this session on PAHOERC, PAHO Ethics Review Committee. I am Carla Saenz. I'm here in my capacity as PAHO Ethics Review Committee Secretary, and I'm also, as many of you know, also PAHO's Regional Bioethics Advisor. This session today is to discuss what needs PAHOERC review during the pandemic. And the short answer is very simple. The same proposals that needed ethics review before the pandemic are the proposals that need ethics review during the pandemic. The reason for that is that the same standards that ensure that research with human subjects is ethical apply both before and during the pandemic. PAHO, WHO, and our member states are ensuring that research conducted during the pandemic adheres to the highest ethical standards. And that entails ethics review prior to starting the study. This is not just an institutional requirement, like it's in the case of our organization, but is in the majority of countries in our region also a legal requirement. As I said, research has to adhere to the highest standards during the pandemic. And if anything, I would say the standards are higher to the extent that there's some extra care involved in ethics review due to the sensitivity of the conditions during the pandemic. What has changed during the pandemic, if anything, you may wonder? The process has changed. We're doing a streamlined review process to make sure that we can conduct ethics review quickly, that ethics review is done well, but also fast. So we are doing at PAHOERC, the same things that we're telling member states to do in terms of an adequate ethics review process that's fast but rigorous and allows committees like PAHOERC to meet the demands posed by the pandemic. And there you can see the guidance that we issued for member states that we are following ourselves in the organization. So I'm going to explain what are these standards that apply during the pandemic and before the pandemic for ethics review of research. But before doing that, I want to explain also why is it that we're doing this session. And you may have noticed that there's a lot of research being conducted on COVID-19 because this is a new virus and we do not know what works. We do not know how the virus develops. We do not know the impact of the virus or the social measures that we are implementing to deal with it. So we need a lot of research. So that leads to a situation in which lots of entities, lots of organizations, including PAHO, that were doing no research or very little research, are doing a lot of research. And that means also that lots of people that were not used to doing research, that may not know how to do research with human subjects and may not know about ethics review, see themselves now as part of research projects. So that's why we're doing this session today. So what are the proposals that need ethics review that at any moment? Proposals that have two specific characteristics. The first is proposals that constitute research. That is, proposals whose aim is to produce generalizable knowledge. Some proposals don't aim at producing knowledge. They aim at, for example, just implementing a public health intervention, or just doing standard surveillance, or doing a training session. So those proposals would not be research. So we need first for each proposal to be research, and second for it to be with human subjects in order for us to say that that's a proposal that needs ethics review. What does it mean to be a proposal with human subjects? This is a technical term too, and means that the proposal obtains this knowledge when dealing directly with people. You either do something with people, you take their blood, you ask them questions, you interact directly with people, or you may not deal with people, but you are dealing with their identifiable information, I should say individually identifiable information or individually identifiable samples. If you're doing a study and you may not be talking to people, but you're using blood samples that have names, or you're using medical records with all the information of the persons included in those records. So if those two conditions apply, first, it's research, and second, it's with human subjects, then that proposal needs ethics review. And ethics approval must be obtained before starting the proposal, before starting the study. So what I want to share with you is that PAHOERC has a process to determine if proposals are research with human subjects, if 1 and 2 apply. So this is what I explained to you is how we do the determinations in terms of content, in terms of what is in our analysis, but we also have a process, a way of doing the analysis, and that means that 3 members of the committee have to review the relevant information and assess that it is indeed research and it is indeed with human subjects. So these determinations about whether a proposal is research with human subjects and needs PAHOERC review, or whether it's not research with human subjects and it's exempt from PAHOERC review, must be made by PAHOERC. Why is that? Because the research teams, the people involved in implementing those proposals, are in a situation of conflict of interest. And with anything else in life, we're not good judges if we're judging ourselves. So to protect the integrity of research, to ensure that research is always ethical, we have a third party, PAHOERC, the committee is not involved with the studies, assessing whether the study is, the proposal is research with human subjects or not. That's always the first step of our review process. We check, is this research with human subjects? Yes. Then we do a review. If it's not research with human subjects, we issue an exemption. And I have to say we do this process fairly quickly, mostly in 1 day, 2 days. And that's something that is not because of the pandemic. We've been doing these reviews in 2 days for many years so far. So you may be wondering too, whose job it is to ensure that PAHOERC approval is obtained. That is the job of the person, the PAHO staff that is leading the proposal or is most closely involved with the proposal. As I said a moment ago, ethics review cannot be done retrospectively. We can do many things, we can be very flexible, but one thing that we cannot possibly do is we cannot go back to the past. So one of the things that I'm happy to tell you more if you have questions about what is it that what's ethics review like? What is it that we're looking into each proposal? But one of the things we'll look at is an informed consent process, just to give a very simple example, how people were invited to be part of the study. And it would make sense for anyone to do that review after such involvement in the study already took place. So that's one of the reasons why PAHOERC, like any other ethics review committee, can only review proposals before those proposals start. So you may be involved in proposals, and you may be wondering if the proposal that you're working on needs PAHOERC review, or even for planning purposes, it's good to know. And in some cases, I think the determination is very easy, and we deal with some difficult cases because given the nature of our work on public health at PAHO, we are often in those in the areas that are at the intersection between research and public health work. So if you're in that situation, if you're not sure whether the proposal that you're still working on, you may not be ready with that, needs PAHOERC review or not, you can submit your proposal and we will screen it as soon as you have the basic information for us to proceed. In order to do that, you have to go to our electronic site, which is ProEthos, a site that we're happy to share with you, was developed by our colleagues in BRM. It's being used by many ethics committees in the region and also in the world. So you go to that site, you create, you register like any other site for which you create a login and include the password. And then you submit your proposal using the consultation option. That allows you to be clear about this early in the process. And I think, we all benefit if we're clear about what are the steps that are coming. And if the proposal needs ethics review, you will be able to submit all the information, all the necessary information later. It may be the case that you are among those people, those teams that are doing research now, are involved in research projects now, and you don't have any prior research ethics training, or you may have some prior research ethics training and may need help figuring out whether a specific aspect of a research protocol is ethically acceptable, or what are the options, what are the ethics guidelines regarding this issue. And if that's the case, we can help you too. We are of the strong view that ethics training among researchers is essential to advance ethical research. We think that ethics review committees do a great job, but we can only ensure that research is ethical if we're on the same team with the investigator, if we're all clear about the importance of the ethical issues and about what the most ethically sound path would be. So please reach out to us if you need help with that. As I said, I have these two hands. So PAHOERC, the committee, works in tandem with my other role as PAHO's regional bioethics advisor, and we'll make sure that you and your team get the research ethics training that you need in order to do a good work in terms of conducting ethical research. So I think it's very important to clarify that PAHOERC is not Carla. PAHOERC is not Marcy, that I'll introduce in a second, that works with me. PAHOERC is a group of people. PAHOERC involves members and observers along with a secretariat. Our members, and many of them are today at the session, are Maripaz Ade, who's the president, Ludovic Reveis, who serves as vice president, Fernanda Alonso, who's our external member, Carolina Chavez, Vilma, whose name I can never pronounce, Jonas González, Hannah Curtis, Ana Lucianes, Maristela Monteiro, Bernardo Nuche, Lucia Oliveira, Pedro Ordúñez, me, who serves as secretary too, and Andrea Vicari. We also have observers. Ricardo Samayo, I'm sorry. I'm sorry, I put Ricardo Samayo, but it's Roberto Samayo. I'm sorry about that. We have observers from 4 relevant entities, and those are Gabriela Gergely representing ethics, Cristina Marsigli from ERP, Roberto Samayo from procurement, and Pamela Zúñiga from legal. From like. So we all work together reviewing protocols. Ethics review is not easy. We don't go around with a checklist, We actually analyze and deliberate about each protocol. And I want to thank all my colleagues at PAHOERC for doing this work that takes a lot of time because we need to read these fat protocols, and also thank their commitment to review protocols as soon as they arrive. We're really organizing meetings every time we get a new protocol. And I want to also introduce to you, Marcy, can you connect for a second? I want to introduce to you my colleague there. She is Marcy Neal. Because of her special role as the secretariat, she's the one that serves as a liaison between the committee and the research team, and she's the person that you will interact most with during the process, and she also plays an important role ensuring the proposals are ready for the moment we as a committee review them. So this is the team. As I said, many of them are here, and they can also tell you if you want to know what's from their perspective to do ethics review of research protocols. We work in a very collaborative manner with the organization, with several. You probably already get a sense from the slides with our membership and our observers about how we work. But we also work with the researchers, with the research teams, and with their counterparts, because we think it's everybody's job to team up to catalyze ethical research. Our goal is to ensure that we're only involved in research that is ethical. Think about that for a second. When you're a research participant, you're accepting some risks in order to produce some knowledge that will benefit everyone. All of us benefit every time we have some health issues and there's already a treatment that works, or a vaccine that works, or some public health measure that works. So that knowledge has been produced with a generous contribution of thousands of people, and it's our moral duty to ensure that every single one of those persons are being treated ethically. It's, of course, a way to protect our organization by ensuring that we're only involved with research that adheres to the highest ethical standards. We are, this is a brief presentation. We're very, very open to any questions, suggestions that you may have. If you want any additional information, that is the website where you can see our SOPs. Marcy may have shared them already, and that's our the email of the committee. But I just want to stop here, and I'm gonna ask if our colleagues, I see Maripaz and Maristela Montero already have panelist roles, so I want to see if they want to add anything from their perspective. Feel free to jump in, please.
Thank you, Carla. Let me start my video so everybody can see me. Can you see me now? Perfect. So thank you, Carla and colleagues. This is a quite important information. I think that you got all the points, the specific points, and just to reiterate that we are here to support everybody. It's been a pleasure being a member of the committee for a long time now. So I think our efforts is all coordinated and coordinated with the whole house. So nothing else from my side at this point to add. Just to reiterate that we're here to support all the efforts towards a better research for the organization. Thank you.
Thanks, Maripaz. I saw Vilma is there too, and Ludovic. So please, colleagues, I am very glad that other members of the committee are here, because PAHOERC is teamwork. It's teamwork internally within the committee, and it's teamwork externally, because we work with all the areas of the organization. Oh, Andrea is there too. More colleagues, more PAHOERC members joining this discussion. And as I was saying a moment ago, we as an organization must feel very thankful to have such a committed team of people that are doing additional work to ensure that all the research done by the organization is ethical. And this is a lot of work on top of everybody else's job. But it's been, I think we're doing so far really, really well. And perhaps you may not know, for example, WHO had to establish a new ad hoc committee for all the COVID studies we're handling so far with PAHOERC, and I think that's just possible because of the huge commitment of our members, and also because we have a strong secretariat support in Marcy. So if anyone in the audience wants to, I'm gonna kind of mute myself and ask colleagues if they have any question. You can type it, or you can. Marcy, correct me if I'm wrong. I think that members may not be able to get the mic. Just let me know how to handle the questions. And if any of our PAHOERC colleagues want to add anything else, please just unmute yourself and go ahead.
Hi, this is Marcy. If you want to ask a question and you prefer to speak, just raise your hand and I can unmute you. And if any members would like to answer the question, you can go ahead and unmute yourself since you're a panelist now. And you can also chat the question and we will respond in the chat, or we will respond to everybody.
While people type their questions, I thought I would add something that I think is important to clarify with regards to research ethics. If you're unfamiliar with research ethics, you may think that ethics review is an unnecessary process. You may think that unethical research happens if evil people want to do research and want to take advantage of others. And while that is a type of unethical research, I think that's a very rare unethical research. And the most common type of research that we see that is not ethical is research that is where there's really not necessarily malicious intent. Sometimes the researchers have not thought about the implications of what they're doing, or have not done a very good assessment of risk, or are sometimes very unfamiliar with conducting research and don't know what are the proper ways to invite people to participate, or to include, for example, children in research, or what can be done and what can be not done when you're doing research with people with, for example, limited cognitive capacities. So the idea of the goal of the committee is to work to ensure that research is always ethical, and that often implies clarifying to the research team what is the ethically right way to do the research that they want to do. So we have a question by Evelyn Rodriguez that if we need to run a survey among 3,000 people, 3,000 adults, to gather public perceptions on specific topics, do you have to approve it? I'm going to go back to our little slide here to respond to Evelyn's question. Thank you, Evelyn. I think this is a very good question. So what surveys can have all sorts of goals. So most likely, I mean, of course, the question is like, why are you trying to gather public perceptions on a specific topic? If you're trying to produce knowledge, are you trying to know something? If that's the case, then that'd be research. It's clear that if you're doing a survey, you're dealing with people because it's people answering the survey, right? So the second one, I would say check. To the first one, I would say, well, we really do not know with the information that you gave us whether the goal is to produce generalizable knowledge or not. And we will need to look at why are you doing it, and based on that, we will do an assessment. As I said, our procedure is to have 3 members look at this to issue a decision. And the reason why we have 3 members is because very often we have the easy cases and we have some difficult cases. And in that case, we discuss, we go back and forth, and then we make a decision. And that can be the case in situations where the goal of the activity is not very clear. Some we have, perhaps Marcy, you can share the CDC policy on distinguishing public health research from public health non-research. I think that is a great tool from which we as a committee have learned a lot, and that we like because it gives examples about, for example, surveys that are research and surveys that are not research based on what they try to achieve with those surveys. There we go. That's thank you, Marcy. That is, as I said, a great tool. So Evelyn, the short answer is like we will need a little bit more information about the aims to figure out if this activity is research and is not research. We see many surveys that are research and few that are not research. Any other question? And what about if we're doing mass administration in coordination with a Ministry of Health? Does PAHOERC have to approve it as well? That's a question from Silvia Padilla. Thank you, Silvia. Mass drug administration in general is a public health intervention that aims at addressing a public health problem. And it's actually the Ministry of Health's job to do to take care of these health problems of the population, and that's a way of doing their work. So in general, the answer is no. But we have seen, and that's been a very important lesson for us at PAHOERC and at the organization, that sometimes you do a public health intervention, and since you're doing all this effort and mobilizing people, you may think, well, since we're doing this, why don't we try to learn something? So why you may want to add a research component to that public health intervention. There's nothing wrong with that. Piggybacking is good, you know. The only thing that you have to do is to ensure that that research component obtains prior ethics approval. So, and if you're not sure, you can always submit a consultation, and we will do a determination. And I'm going to add another layer to my answer now. So we've been talking about what's research and how to ensure that research is ethical, right? But we should be ensuring that all the work we do is ethical, not just that the research is ethical. To ensure that research is ethical, specifically to ensure that research with human subjects is ethical, the tool is ethics review. That's how we do that. And we have specific guidelines. We use the CIOMS guidelines that perhaps Marcy can share with us too. And so that's the way of making sure that that is ethical. But we do have other guidelines, and we do support teams and member states and country offices to ensure that other types of work, like mass drug administration, that are not research, and you may say, it's clear that this is not research. You want to make sure that that's done ethically too. We have, for example, guidelines on ethical guidelines on public health surveillance, and we're happy to share those with you and to explain those with explain the guidelines to your teams. For example, you may know about the steps, the PAHO's, WHO and PAHO's steps methodology to do surveillance of non-communicable diseases. STEPS is not research with human subjects, but they still want to make sure that the work that, because they collect data, they interact with people, they want to make sure that the process is done ethically and that they adhere to the highest ethical standards in all these interactions. So we do ethics training sessions with all those teams involved in the implementation of STEPS across the region. And we'll be happy to give you the adequate ethics support that you need, even if this goes beyond PAHOERC. And as I said a moment ago, I'm changing like hats from the PAHOERC hat to the bioethics advisor hat. But bottom line, PAHOERC also advances the view that all activities must be done ethically. What about collecting, Clara Barajas says, what about collecting country data on a specific topic? Data from country registries, which includes previously collected data from individuals, but we don't receive identifiable information. This is, again, a very good question because this is a very common scenario. So, as I said, two conditions need to be applied. It needs to be, you need to have a research objective. You need to aim at producing generalizable knowledge, and the activity has to be with human subjects. So if you're doing research, let's establish that that's a research goal, but you're not dealing with the individually identifiable information of people, then the second condition with human subjects would not apply. So that would be research that is not with human subjects, and PAHOERC review wouldn't be necessary. So I want to clarify, and I think that if no individually identifiable information is involved, that's really an easy case. But many teams still decide to send the proposal for PAHOERC review as a consultation. Why do they do that? Because even if we would say that this is research, but it's not with human subjects, and it's exempt from PAHOERC review, when we do that, we will issue an exemption. And that's an official document that you may want to have later in the future. Because you may want to write a paper about this, and when the paper gets submitted for publication, the journal may ask, hey, did you get ethics review? And you will say, no. And they'll say, and why did you do that? Did a proper third party specify that this did not need ethics review? And if you get that answer, well, then you will have a proper exemption, and that settles the issue. Journals want to make sure they do not publish unethical research. And unethical research is research done without ethics approval. So they are getting increasingly more vigilant about ensuring that ethics approval is obtained, and that when it is argued that no ethics approval was needed, that is no longer not just an argument, but that is confirmed by a relevant party, which in this case is PAHOERC. So even if I could answer the questions like, yes, no individually identifiable information means no research with human subjects, you may still want to submit a consultation to have a formal exemption. And that may be, depending on the processes, the administrative processes at stake, you may actually need it within the organization. Any other questions? And again, please, PAHOERC colleagues, if you want to jump in, please feel free at any time. I saw Santiago Nichols. I'm going to read in English so the non-Spanish speakers understand. If during the pandemic we do studies that imply close contact with persons, are there specific requirements to take into account in order to minimize risk of contagion with communities and healthcare workers? That's a very good point, Santiago. We are, in our review of proposals, we are taking this into account, and we're making sure that that studies are conducted in a way where risk is minimized, and the risk of doing research in the pandemic is not just the risk of the study, but the risk of contagion. So, for example, we've had studies where focus groups were discussed, and we're like, no. Now we need to have we need to have individual interviews, for example. So we assess proposals on a case-by-case basis, but we are taking this into account, and we are also taking this into account for informed consent processes. And I think this is a topic on which we've taken like so many important steps during the pandemic for expression of consent say a person is in the hospital and is invited to participate in the study, and then the person cannot consent on their own. So other, say, like a spouse or a child or a parent needs to provide consent on this person's behalf. The standard procedures that are being used now involve doing consent through WhatsApp or through a phone call. It's mostly like a WhatsApp call, and countries are moving really, really well that way. So we have another question from Caroline Allen. If you have concerns about a proposal, what is the process for addressing them? Can a proposal be reworked and resubmitted? Yes. So proposals, let me start by clarifying something else. The majority of proposals we reviewed are proposals that have obtained ethics approval already in the country. We can only approve a proposal that has already been approved by the country. And usually we do local ethics approval and then PAHOERC approval. But of course, during the pandemic, we cannot take our time, so we're really working simultaneously. And in both cases, both when you look local ethics approval and when you look at PAHOERC approval, what most likely is going to happen is that you will get feedback from the committee, and the committee will say, we have certain observations. We need you to do A, B, and C, right? The one thing that is particular about PAHOERC that is a little bit unusual and something that I think we as a committee are very proud about is that we try to maximize interaction between the committee and the investigator since the very beginning of the process. It's not that you will send something to a black box and not hear from us in months. No. And we will not wait till the entire committee has gone through the proposal to get back to you. We don't think that anyone benefits from a long process of ethics review. We all benefit from ethics review, and there's no reason why it needs to be too long. So we have experienced that the process is a lot shorter if we have a closer communication between the committee and the research team. So, and that's why I also thought it was so important to introduce Marcy to you, because Marcy is going to be the first person going through the details, and if she sees that she knows that some things the committee will ask for, because those are the international ethical standards. So she will not wait till the day of the meeting for everybody to read this and ask you for whatever is needed. She will immediately communicate with the research team. So whatever pieces may be missing, and very often it's pieces that are missing, are submitted as soon as possible so the committee can have the most thorough assessment of the proposal. So after the committee reviews the proposal, after committee deliberates, as I said, you will receive some observations, and we will expect that you address them, and we will work very fast to respond to review your responses to that observation in order to issue an approval as soon as it is possible. So it's a very interactive process, and we all in thinking about the best use of everybody's time, we also think that it's useful if you have some questions about, hey, I don't know how I handle research with children. How does that go? If you have questions like that, and you're still working on your protocol, or you're working with a research team, and you can tell they have questions, feel free to email us and ask us your questions, and we'll give you the specific guidance that you need so you can complete that, and we can all make these processes shorter and ensure that ethical research can start as soon as possible. So, and that Marcy just included the the email, the PAHOERC email, in case you have any questions. So Santiago Nichols added something. Would we need to review and resubmit protocols that were approved pre-COVID-19 but whose implementation has been postponed because of the pandemic? If the changes in the way in which the studies are being conducted are substantive, yes, you will need to submit that as an amendment. If the changes are just simple and you're like, I don't know, just doing over the phone what you are doing in person, since everything is being done remotely anyways, perhaps that's not necessary. If you want to be sure, you can check with us for the specific variations. But I'm thinking perhaps you will also need to adjust the informed consent processes, because you may be describing a way of doing a study that's no longer feasible. So, and if that's the case, if there's the need to change informed consent processes, what we advise is that yes, you do submit it, and it's going to be an amendment, and we will handle it fast. I mean, amendments of this nature will not need to wait for what we used to call the monthly meeting, except that now we meet a couple of times a week because we have so many proposals to review. Any other question? Okay. Well, thank you so much. I don't know, I'm gonna just give it, while other colleagues type their questions. Let me see if our colleagues may want to add anything else. It's great to have them for you all to see that this is not just Carla, this is not just Marcy, this is genuine teamwork, and you need a lot of brain power to go through all those protocols and to do that quickly. Colleagues, any comment, any addition? Oh, I see we're also Hannah Curtis and Gabriela Gargali are with us too. Okay, so I guess if no one has any more comments or questions, then we'll end the session now. Thank you very much for joining. We have recorded this event, and we're happy to answer all your questions. As we always